Hello and welcome to the Kansas Advocates for Equity, Education, and Health informational webinar. Thank you so much for your interest in learning about this opportunity. I'm Shawn Brown with the Kansas Health Foundation, Program Officer for this initiative, and I'm so glad you joined us this afternoon. So in conceptualizing this initiative, we spent a lot of time in 2020 thinking about how we might best impact educational outcomes. And so in conversations with United Methodist Health Ministry Fund, we decided to partner in this effort as they were also interested in impacting children during the early years, especially from the perspective of making sure that children are healthy and ready to learn. So through this collaboration, KHF is providing funding for the grants to be awarded to 3 selected organizations. And United Methodist Health Ministry Fund is providing support for grantees to receive technical assistance. So you can see members of the planning team listed here. Joining me today from the Kansas Health Foundation are Blair Wiebert, Grants Officer, Deanna Van Hirsch, Interim Executive Vice President, and Nadine Long, Director of Strategic Learning. Our partners from United Methodist Health Ministry Fund are David Jordan, President and CEO, who's unable to join us today, but we're delighted to have Katie Schoenhoff, Director of Programs, with us this afternoon. I also want to recognize and thank members of our Education Advisory Group and other stakeholders that provided feedback during the RFP's development. Technical assistance for this grant will be provided by 2 organizations, Community Catalyst and Sati Impact Consulting, and Community Catalyst also played a role in the development process. So we're pleased to have Emily Pollock, Program Director, State Consumer Health Advocacy, and Eva Marie Stahl, Associate Director of Policy, as team members. And we also want to acknowledge conversations with Beena Patel from Sati Impact Consulting, who we anticipate will play a role in future TA training sessions. So our agenda today is to provide an overview about the grant opportunity. And so we'll describe the RFP, cover the program design, walk you through the online application. And during the last segment, we'll have time for Q&A. As you think of questions, you can type them into the chat as we go along, and we'll save time at the end of the presentation to answer them. When we get to the Q&A section, you can also unmute yourself and ask questions verbally. This webinar is being recorded, and the webinar will be posted on the Foundation's website in case you want to review it, with community partners later on. So to provide the backdrop for this initiative, it's important to understand KHF's theory of change and how United Methodist Health Ministry Fund operates to impact change. So to start us off, I would like to turn things over to Nadine Long for those highlights, followed by Katie Schoenhoff.
Thank you, Shawn. Hi, everybody. I am so excited to be with you this afternoon to provide some background information on what Shawn described about how this work fits into KHF's larger theory of change. And I'll also briefly go over our plans for the evaluation of this initiative. So you can see at the top, KHF's vision is that every Kansan can make healthy choices where they live, work, and play. And the theory of change that you see in front of you lays out how we approach our work to move us closer to that vision. We have 4 key impact areas: increasing access to care, healthy behaviors, civic and community engagement, and educational attainment, which is our newest area of focus and also the place where we will be spending our time this afternoon. To make progress in those 4 areas, we work with our grantees and partners to increase capacity to implement policy, system, and environmental interventions, or PSE for shorthand, to increase awareness and support among the public, influencers, and policymakers about issues affecting health and potential interventions to address them. And last but not least, to increase action at the organizational, local, state, and tribal levels leading to PSE change. As I mentioned, this particular initiative falls into our educational attainment area, but I did also just want to recognize that we know many systems interact when you start thinking about the underlying factors that impact education, such as children being socially, emotionally, and physically healthy and ready for school. So because of that intersectionality, we recognize that access to care or healthy behaviors or civic and community engagement could also play a role in improving these outcomes. The last thing I wanted to note about our theory of change is that with all of our work, you see this circle around the 4 key impact areas that says increase equity. We apply a lens of equity around all of our areas of work so that we are intentional about focusing our efforts on those Kansans who are experiencing the greatest barriers to living a healthy life. Finally, I wanted to briefly mention that in an effort to learn and grow as a community, we are contracting with a third-party evaluator to work alongside us in this initiative. So KHF staff, United Methodist Health Ministry Fund team members, and our grantee partners will work together to design an evaluation that centers equity and is generating useful information for everybody involved. Related to that, we are working really hard to reduce the reporting requirements as much as possible, knowing that you all have a lot on your plate. And reducing administrative burden is one small way that we can show we respect your time and the work that you do, while helping us continue to gather important information about how the work is unfolding. We wanted to highlight these evaluation and learning activities so that you can make sure to take these into an account when you look at assigning personnel hours in the budget that you develop for this project. And you'll hear more about the budget piece of this proposal later, but again, just wanted to highlight that so that you are adding in the hours for staff, knowing that these activities will be occurring alongside any advocacy efforts that you'll be taking on through this effort. And with that, I will hand it over to Katie.
Katie, if you're talking, you're on mute. Looks like we may have lost Katie. I will just take a moment to cover this, and we can kind of come back to Katie once she's able to join. So in terms of the United Methodist Health Ministry Fund, as I mentioned earlier, one of the important things is thinking about early childhood development and the support that's needed for evidence-based childhood mental health and development programs.
I'm sorry, my internet just disconnected.
Oh, wonderful. You are here. Well, I was just, go ahead, Katie, take it from here.
I am so sorry. I'm getting an internet issue, so I apologize. So again, thank you so much for having us be a part of this process, and just a bit about United Methodist Health Ministry Fund. And this is one of our strategic funding areas is around early child development. And we see
Katie, we lost you again. Well, my apologies for the technical difficulty. I know Katie's having trouble with her internet, so we will allow her to take some time and connect. But as mentioned, the goal is just really about ensuring that children are physically, mentally, and socially healthy and ready to go to school and learn is one of the key factors. Katie, are you back with us? Well, when we think about it, you may wonder why focus on equity, education, and health. And the fact is that we believe all Kansans should live in communities of opportunity where there are good schools, healthy environments, safe homes, quality jobs, access to health care, and high quality equitable goods and services are the norm. We believe that education is really a critical piece of creating and supporting communities of opportunity, and that multiple systems really have to work together to ensure that children are healthy and ready to learn. So one of the indicators that we track here at KHF is that more Kansas students are graduating from high school, and not just graduating, but being college and career ready when they graduate. So to improve high school graduation rates, we know that from research that the early years are most critical to making sure that, as I said, that children are ready to go and be successful in school and ultimately be economically mobile and able to support themselves and their family. So we recognize that we can't just think about education in a silo, understanding that there are underlying factors impacting educational outcomes such as intergenerational poverty, health, and inequities in policies and systems. So a multi-pronged agenda is needed. So what determines health? You're likely quite familiar with this graphic or one similar to it. We know that 20% of health can be attributed to healthcare, with the other 20% being attributable to genetics. But as we see noted in orange, 60% of what determines health is the social, environmental, and behavioral factors, most commonly known as SES, which are the social economic status being income, wealth, and education. And so this is why we believe that education is central when we're thinking about health outcomes, because it impacts income and wealth. And we believe that access to educational opportunities can have a lifelong impact and really open a child to a world of endless possibilities. So the question we asked ourselves is, how can we improve educational outcomes for all Kansas children, especially children of color and those in low-income households? So what does the research tell us? Kansans with higher levels of education typically have better outcomes, health outcomes. And so Kansans with less than a high school education are 10 times more likely to have no health care insurance. We know things like gender and race and health insurance coverage and a parent's educational level, that these can all have a significant impact on how upwardly mobile or downwardly mobile a child's health is. We also know that multi-generational disadvantage requires multi-generational solutions. We can't just think about education and well-being today in isolation. We really have to look at the child's environment and the social determinants of health that are impacting it. So what are the resources and the assets in the neighborhood? What's happening in the family unit and the household? And we know that we need to focus on the formative years, which is why the prenatal to age 8 time frame is so important. The other thing we know is that our economy is increasingly based on skills and knowledge. So 64% of all the jobs in Kansas in 2018 required some sort of post-secondary training beyond high school. The other thing that is of concern is that we know that the number of students that are not proficient in reading by 4th grade remains a challenge. And what's even more concerning is that when disaggregated, we see this number rises to 72% for Hispanic or Latino students and 83% for Black or African American children. And so, you know, with COVID and the pandemic, that gap stands to widen even further with students losing academic gains. And according to the 2020 McKinsey and Company report, COVID-19 and student learning in the United States, Black and Hispanic students will lose 3 to 5 months more than white students, and low-income students stand to lose up to 12 months. So as we begin pondering this data, we took this approach: awareness, engagement, and policy and action. We started with an awareness campaign, Can't Wait to Read, that launched in February 2019. And then we funded the Sparking Imaginations Building Literacy Initiative, which is part of the Dolly Parton Imagination Library. And so with that initiative, we're providing books for children from ages 0 to 5 in 8 targeted school districts. We also created parent reading resources in English and Spanish. And then moving into the policy and action arena, we funded the Community Supporting Early Literacy Initiative, which supports 8 multi-sector community collaboratives working to increase the number of Kansas fourth graders that are proficient in reading. So continuing with this focus on policy and action, the next step was to go beyond the literacy emphasis to think more broadly about the systems and the environments impacting the whole family to better improve educational outcomes. And really, you know, COVID-19 has presented a unique opportunity to examine the systems in which inequities thrive, particularly as it relates to education, and to reimagine these in ways that address the diverse needs of students and families so that really more children are being set up for success in the classroom. We recognize the need to consider the impacts of the underlying factors, again, as you've heard, just socioeconomic status of families and access to care and support services. So that's why we're launching the Kansas Advocates for Equity, Education, and Health. So the goal is to really, through this initiative, support 3 champion organizations to create and implement an interconnected advocacy vision, prioritizing educational outcomes for prenatal through age 8 children. We also anticipate that you'll use a 2-generation approach to really advance this multi-pronged agenda, and then focus on policies that will increase children's long-term odds for academic, physical, and mental health, and ultimately economic mobility. So when we talk about a 2-generation approach, what we really mean is a whole family approach that focuses equally and intentionally on services and opportunities for the child and the adults in their lives. So this approach articulates and tracks, you know, outcomes for both children and adults simultaneously. And you can see here in this graphic, and the next slide that comes after it, these are from ASAN and the work at the Aspen Institute. So here you see the 2-generation approach can really be found along the continuum. And at opposite ends of the spectrum, you have some of the policies and programs that are strictly child focused. In some cases, you have organizations that are targeting adults and are parent focused. But as you move toward the center, you see more approaches that are focused, you know, primarily on the child, but moving towards a 2-generation approach. That include services and opportunities for the parent. And then with the parent-child approach focus, first, you see that primarily being on the parent, but moving towards a 2-generation approach, which includes services and opportunities for children. So again, this 2-generation approach is very important. And again, it doesn't just mean parents. It can be a grandparent or other adult caregiver in a child's life. So why is this 2-generation approach important? Well, back to our earlier research, we know that investments in high quality early care and education yield a 13% return on investments based on an increased school and career achievement. We also know at the same time that parents who complete a college degree can potentially double their income. So as a parent's level of education attainment is also a strong predictor of a child's success. And we know that when parents have higher levels of educational attainment, it typically means there's greater opportunities in which there's more financial resources to provide for their child's education. And we also know that these 2-generational approaches, they can include a variety of early childhood development programs like child care and Head Start and home visiting. So who will benefit? Kansas children that are age prenatal to age 8 and their families that are experiencing some of the greatest barriers to success. And so through this initiative, we anticipate that there will be a special emphasis on Black, Indigenous, people of color, Hispanic, low-income families with, as I said, children in that age range. So who should apply? Well, organizations with authentic connections to racially and culturally diverse low-income families with, again, prenatal to age 8 children. So is your organization ready to think in bold new ways? Are you having conversations and posing the question, what if, and you fill in the blank? Or are you having conversations about what would happen if we considered approaching things this way? And again, you fill in the blank. Are you having those types of conversations in your larger networks and thinking collectively, as we emerge from COVID-19, what has changed? What needs to be different in terms of a policy approach? We're looking for nonprofits that are thinking about bold new ways to advance policies that create opportunity for all Kansas children, especially those that are racially and culturally diverse, and adults using a 2-generation approach. So we want to hear ideas from community champions that are focused on educational equity and community wellness. And then lastly, of course, the organization needs to be tax exempt as identified here. So through this initiative, we are asking organizations to consider how they will create a shared agenda and a vision with the support of KHF and United Methodist Health Ministry Fund that really focuses on early childhood education, school, and health policy systems to change and improve educational outcomes for BIPOC and low-income households. So this would be a shared vision among your local network of organizations that you may already have connections with or be in partnership with as a result of this initiative. It would also be a shared vision among the organizations that are funded to think about what you might achieve at a state policy level. So thinking about policy from 2 vantage points, both impacts at both the local and the state level. Aiding Kansas schools and early care education providers in designing and delivering equitable educational opportunities will be important. Again, COVID has opened the door that has required organizations and early care and education providers and schools to really rethink how they operate. So what systems have changed or need to be changed, and how can your organization support that? And then building power for nonprofit leaders and communities engaged in advocacy for equity. This means looking at how leadership is being cultivated, supported, and ways of keeping the voice of grassroots leaders and the community central. So in terms of the approach for this initiative, community conversations should start at the local level. So what are you hearing from students and parents and stakeholders and teachers and early care and education providers? What are their concerns when it comes to education? How are you co-creating those educational opportunities with parents and caregivers in mind? Prior to COVID, what about mental health, the mental health of children and their adult caregivers? Prior to COVID, we know that mental health for children was a huge issue, and with the impacts of COVID and those challenges, it's even more troubling that some children are following behind academically. So what kind of conversations are happening in the community around that? And then it's about engagement. What conversations are you having with policymakers and decision makers? What are their concerns? And then thinking about vision. What is your vision for what you want to see happen? For example, Randy Watson, Kansas Commissioner of Education, put forth a bold vision that Kansas leads the world in the success of every student. What's that big, hairy, audacious goal that you have when you think about the vision of what you want to see happen? And then how are you going to move that in terms of policy and actions? Thinking about what activities you're going to carry out over the next 3 years when you're thinking about the sustainability of your efforts and your plan. And community leaders should be driving that policy and action. So, and we also know that what you propose in your application will likely change as you seek to go through, more of a design process and thinking when you're thinking about addressing root causes and examining the systems that really influence educational outcomes. So during the first year, you'll have the opportunity to really focus on this process, which is where the technical assistance and support comes in. So before we cover these policy areas, I'd like you just to take a moment and close your eyes and think of a child who's very special to you. It could be your own child, a grandchild, a niece or a nephew, a child you're mentoring perhaps. And think about the vision and the dreams that you have or had for your own children and grandchildren, and wanting them to reach their potential, their highest and best self. So when they graduate from high school, they're academically, college or career ready, and they have the highest level of well-being, mentally, socially, and physically. And those are the policies and the systems that I would challenge you to fight for and to think about, because that vision is collectively all of our Kansas children. So as you think about the focus areas to address these underlying systems and economic situations that impact health, I also encourage you to think about sustainability from the perspective of how can the policies be instituted and supports and services be proposed to maintain those. So when you think about these policy examples that you see here, we talked to a number of stakeholders, and this is not an official survey by any means, but these 4 policy categories that you'll see on the next slide rose to the top, with the first one being family community impact drivers. So thinking about ways to promote and improve socioeconomic wealth and health status of families. And the thing that rose to the top here was promoting policies that connect low-income Kansans to good jobs and training and employment and family-sustaining wages. The other thing that rose to the top here was thinking about behavioral health and wellness. As I mentioned before, we know that mental health is a huge issue for a number of children. So thinking about trauma-informed schools and care. And when we talk about trauma-informed, it means being informed and sensitive to the trauma and providing safe and stable and understanding environments for students to be able to learn. And the same goes for when you think about it in the care situation. So with that, if Katie is able to join us and connected, I'd like to turn it over to her. All right, wonderful, Katie.
Well, again, I apologize for the issues earlier. So again, as we highlighted, we see policy change as essential to improving the health and education and economic outcomes, as well as equity. While we outline 4 broad areas of policy that align with our goal to improve school readiness and student success, we know that where you start with your proposed policy agenda and your proposal may not be necessarily the end of where your policy agenda is. So know that we are here to help answer questions. And again, you'll have the provision of technical assistance if your proposal is chosen to help you refine your policy focus over the next year. So I think that'll be a really important piece to consider as you move forward in thinking about what makes the most sense. And again, envisioning that, I love that piece that Sean shared. So thinking about healthy families, policies that are focused on building and delivering high quality systems of care to promote wellness of mind, body, emotion. So expanding Medicaid support and enrollment for children 0 to 5 to cover parenting programs to support social emotional learning and maternal depression screening and referral to treatment and interventions. Those are some of the ideas that emerged as this also came up in thinking through that, as well as it's important to note that all of these policy areas, we are careful not to develop a comprehensive list of policies because we want to avoid it being prescriptive. But at the same time, we also know that there are some structural policies that cover for services and a sustainable financing for our early childhood systems, that it's critical to supporting children 0 to 8 have the best start in life. So these are a few pieces around the early childhood education, improving the quality, affordability, and access to early childcare and educational programs for BIPOC and low-income families, as well as workforce development to better recruit, retain, and advance a diverse workforce to meet the needs of young children and families.
Thank you, Katie. So what does success look like? You know, centering voices of racially and culturally diverse Kansans and low-income wage earners, and advocating for solutions that they deem most impactful so that all Kansas families can thrive is important. If you think back to the approach outlined, it's this step that's critical because, you know, when we're talking about centering the voices, it means being careful of the power dynamics that sometimes happens when organizations can come together and think about how you can work in new ways to support policy systems change. That really comes from the people and seeks to provide full access to equitable pathways for educational, health, and economic and social opportunity. Creating a shared agenda will be crucial as you begin to work together. It's focusing on the policies, again, that don't just impact adults, but also children and the whole family. And so the purpose is not for a single organization to come with a predefined policy agenda, but during the first year, you'll be able to take some time to define what that policy approach needs to look like. And then building stronger power-based networks for greater educational opportunities and supporting early care and education. We also want you to think about scaling big ideas that are going to be focused on the whole child, that support a two-generation approach in child-centered learning, and then helping decision makers really understand and increase their commitment to greater equitable health outcomes. So in terms of technical assistance, in addition to this grant, KHF and United Methodist will work with grantees individually and as a cohort to provide technical assistance to build the organization's capacity and support policy and programmatic efforts. And so to tell you more about that, I'd like to turn it over to Emily from Community Catalyst. And Emily, if you're speaking or having technical difficulties, let me know. Eva, I know you are also on the call. And are you there?
I think you just unmuted me. Can you hear me now?
All right. Yes.
Perfect. Okay, everyone, it's a pleasure to webinar e-meet you. I'm Emily from Community Catalyst, and we are delighted to be joining the technical assistance team for this project to be supporting grantees with time-sensitive, tailored strategic guidance over the course of the grant. Community Catalyst provides this technical assistance based on our system of advocacy approach, where we acknowledge that no one organization will be able to excel at everything needed to pursue a campaign all at the same time. And so working in coalition and partnership to boost organizational capacity really is key. We focus on supporting advocates on the state, regional, and local level as they boost and build their own capacities in terms of policy, communications, coalition building, grassroots organizing, and financial sustainability. And we tie it all together in campaigns and movement building. And really throughout all of these capacities, we work to support and infuse an equity and specifically a racial justice frame into our technical assistance. We will be providing individual coaching and technical assistance to all the project grantees across this range of capacities, as well as any other needs that we can support as projects proceed, and especially as you all identify what your policy agenda will be. And we'll also be able to provide grantees with connections to other groups around the country where applicable, who are also working on or who have already achieved similar policy outcomes, sharing those best practices and strategies that have been successful in other states and communities. And again, we are just delighted to be part of this team and look forward to working with a collection of you.
Thank you so much, Emily. So while you're preparing to submit, you'll want to continue to have conversations with interested stakeholders and parents and students and caregivers and various agencies. And we think, these are going to be preliminary conversations, which we anticipate will continue throughout the grant process. Also, it's important to continue to make connections with potential partners and other organizations that are impacting educational and health outcomes. And then think about cross-sector collaborations amongst organizations focused on birth to 8 years and the educational outcomes for that group. And then also being in contact with your local school districts to understand any challenges and vet ideas. So again, here's a list of potential organizations, because a strong cross-sector collaboration with a diverse and well-rounded team are really needed to vet bold ideas that the community envisions. And you may already be working with many of these types of organizations or have them in your network, but if not, now is the time to do some analysis and really think about any gaps or who you might want to talk to or include in your plan and your proposal. So in terms of the types of information that will be requested on the application, if you again think back to that vision of that successful graduate, think about your application's mission and its relationship to this proposal. Think about how you would address the root causes of inequitable outcomes for Kansas students and families. And then think about, what bold new policies do you want to see instituted and to basically see come to fruition, particularly as it relates to BIPOC children. And then thinking about that planned approach for developing a collective policy agenda. In terms of proposal screening, again, you can see that we will be looking for organizations that have a readiness to effectively implement high quality advocacy work, and looking at how well you've defined the issues impacting the community that you support, thinking of children and adults, so that a clear equity issue area is defined. Thinking about a thoughtful plan, we'll be looking at that in terms of engaging, the proposed advocacy efforts. And then lastly, is there a compelling vision for bold policy advocacy? So the grants that will be awarded will be up to $100,000 annually for 3 years for a total of $300,000. And these will be going to 3 organizations with a start date of May 1, 2021 and concluding April 30th, 2024. Again, you're likely most familiar with these funding restrictions. I won't take time to go through all of those. And then I'd just like to call your attention to a couple of dates. The proposal is due March 5th by the end of the business day. The awards will be announced in April 17th. The grants will start May 1. We will have a kickoff cohort meeting May 27th, and then the grants will be concluding on April 30th. And then just regarding that kickoff meeting, we do plan to do that kind of in a 2-part fashion and connect with you again in June for part 2. So with that, I will turn it over to Blair to talk a little bit about the online application.
Thank you, Sean. And I'm going to share my screen so that you guys can see the application process. So first and foremost, all of our applications can be accessed and are required to be submitted through our online grant making portal. You'll access the portal by going to our website, kansashealth.org. If you scroll down, you'll see here the funding opportunity for the Advocates for Equity, Education, and Health initiative. And then on this page, we have a section called labeled How to Apply. And if you here, it'll take you right to the login page. So if you're a current user, you already have an account, you've applied for a grant before, feel free to put in your username and your password. If you've forgotten your password, you can click here and you can reset it there. If you're not sure about you can't remember what your username is, Candace Malone is listed here as a contact to help you with locating your username. If you are a new user, so you've never registered with us before for an account, you've never applied through our online grant making portal, you'll click here on new user and you'll go through the process of registering your account. It should be pretty quick. We do ask this question here specifically for grant writers, that if you're a grant writer, you would click yes, and then all it's doing is it's asking you to get into contact with Candace Malone. And we do have just a little bit of a different registration process for grant writers. So that's the only difference there. If you were to come in here and you would select no, which I assume most of you probably would, it'll take you to where you can look for your organization, and then it'll take you through the your contact information, all that general stuff. So if you have your username and your password, you'll log in. And then once you log in, it'll take you to the home page. If you have not started an application, the application can be located here under Open Grant Opportunities, and you'll click here, and it's got a brief description of the grant. It gives you when it opened, this funding opportunity to apply. So applications were open February 1, and then it gives you the deadline for March 5th. If you have started an application, you'll click up here in applications and one should be listed there for you. I'm going to go ahead and start a new one today so that you guys can just see that. It'll take you right into the application. And you'll see we've got we like to call it a little menu of all the different sections that you'll be completing. So we'll just start here with the project overview. So this is just the basic information for your proposal. It does give you a project title. Feel free to edit that. That's just kind of a little quirk for our system that we give you that little head start. But if you want to make it more specific to your project, feel free to edit if you want. Then we've got the start date of May 1. Actually, there we go. And then we're going through April 30th. Oops. And then we're going through 2024. And then you've got your project description. And then down here, you've got the geographic region served. You'll click here to select something, whichever applies to you. If you're not sure about which areas apply to you, you can click on this link and a map of Kansas does show up, and we have some predefined areas for you to select. So you'll select all that apply. So if you're in more than one region, you can select more than one region. That works fine. And then the next section are the grant contacts. So these are all of the people that we would like to know who's associated with this project. We have different roles defined up here that you can use. Whoever is starting the application or is, so like for me, for example, it's automatically going to put you as someone that we can contact for the proposal. You can always edit this if you feel like someone else should be listed as this. You can always go in and edit, and you can also select multiple roles for whoever this is. So like say, for example, I'm also consider myself to be the project director on this grant, then I can select project director. And then this field up here, it just lets us know that this person needs access to the application. So if multiple people within your organization, or if someone outside of your organization needs access to edit the proposal, this is where you would identify that. If they do say, if you select yes, that person will get an email letting them know that they've been invited basically to have editing rights on this proposal. And then when they log in, they'll be able to open up the proposal and edit as needed. So that's for if someone is already listed up here in the table. If you need to add somebody, you'll just come down here below and you'll search for them. So we'll search for Gina. And if she shows up, you can just click her right here. And then the same questions that I just showed you, they'll pop up here. Do they need access to the grant? What's their primary role? And then if they have any additional roles, then you can select those down here. And then you would just click add, and then they'll be added up here into the table above. If you didn't see the person you were searching for, you can always add a new contact, and you can add their name, title, email, phone number. And then once you click save, you'll want to go and search for them so that you can continue identifying the roles that they play on this grant. So the next section is the narrative section, and this is kind of the meat and potatoes of your proposal. These are the questions that Sean went over in her part of the presentation. And this is pretty simple as far as completing it. You'll have just some basic text boxes that you'll fill out for narrative questions. We've got our budget section next. So as Sean had mentioned, we're looking for a 3-year budget. Total request is up to $300,000, and we're looking for $100,000 per year. The way that you'll complete the budget is you'll do add new budget year, and then it'll bring up a window, and you're going to want to put in the amount for each category, and then you'll want to put a description for each category. And each category, we have some guidelines of what we're looking for. So you can read those here, and that'll help kind of guide you on the descriptions and telling us where you got your numbers from. But you'll want to tell us which grant year you're budgeting for. So if this is the first year, you'll select one, and then you'll put in an amount, and you'll put in your explanation, and then you'll go through each category. So you've got salary, or your personnel, any consultants that you might be working with, any specific project costs associated with this grant, and then any indirect costs. And as you'll see, it does the math for you, which is really nice. So if you add $500 for consultants, you can see that number goes up to $1,500. So when you're done, go ahead and click Save, and it'll add it to the budget table. And as you can see down here, it's going to give you that total amount requested as well. So same thing out here, it does the math for you. So this number here in the black, it should say no more than 300,000. So if you see something kind of funky, you can always go back in and you can edit whichever you need. And you can go back in and make your edits. And let's say, let's go up by $100 there. We'll click Save, and you can see that again, it makes that edit for you. And if you make a mistake or you add something like an extra year or what have you, you can always delete it, and it's going to be no problem. And then you can just start over. So it's pretty easy to go and make your edits there. And then I believe our final section is going to be the files. So the main things that we're looking for is what we call an Acknowledgement of Agreement review. What we're asking here is that you review the grant agreement template. This would be, if you got funded, this would be the agreement that we would send you to sign. And what we're asking you here, if you download it, is we're just wanting you to review the terms that are listed. If you see anything that raises a red flag or anything like that, we ask that you let us know. Otherwise, if everything looks good, then what we ask you to do is we have a second form, and it's just saying that you sign this, saying that, we've reviewed the agreement template, everything looks good to us. If we're awarded funding, we have no problem signing the agreement. The second thing, this would be, again, if you are awarded funding, we need a completed W-9 and an electronic funds transfer authorization form. This would be for our finance department. This is just giving us permission to do direct deposit. So if you are awarded funding, we would need these on hand before we can issue any funding. So really these first two things, it's just in case you're awarded funding, so that when we have those on hand, if you're awarded funding, we can get dollars out the door as quickly as possible, and we're not having to go back and forth about paperwork. Other than that, we're really just looking for financial documents. So a 990, a balance sheet. If you guys have an official audit, we would like you to attach that as well. And then a financial statement of activity and a statement of cash flow. If you have any questions about any of the financial documents that we're requesting, feel free to reach out to us here at grants@khf.org. We're more than happy to work with you and get you what you need, get you questions answered. Once you have your documents, you'll upload them here. You'll click on New. And so you'll choose Files. And let's just say you select your file here, click Save, and then it's uploaded. Anytime, so if you uploaded something on accident, you can always delete it. And then if you want to preview what that looks like, you can click on it and it'll bring up a preview of what you're looking at, which is pretty nice. Anything that you upload will always be available here. So in the future, say you submit and then a month later, you're looking for some document that you submitted, you can always go into your applications and you can open here and you can go to the files and then you can always look here and you can open it up. And it should, yeah. So if you want to print it off or if you want to download it, that's always available to you. And this is even after you've submitted your application. So that's it for my part. Sean, let me stop sharing. And Sean, if you want to open up your PowerPoint again.
Sure.
So like Sean had mentioned earlier, proposals are due March 5th at 5 p.m. So make sure that you get them in before that time. The applications do get time stamped when they come in. So if you do submit, at 7 p.m. on March 5th, unfortunately, that would be considered ineligible. So I just want to make sure that you have that knowledge as you're preparing to submit your applications. If you have questions, Gina Hess is our grants associate and her email is ghess@khf.org. Feel free to reach out to her, or you can also reach out to that grants@khf.org email as well that I had mentioned in the proposal. And with that, Sean, I'll hand it back to you.
All right, great. Thanks, Moya. So with that, I would just like to take this time to open it up for questions. I know technically we are at time with 3 o'clock. We did go a little bit, open up a little bit later to allow people to join us. We had over 60 people on the call, but I do want to take a few minutes to answer any questions. If you have to leave, that's fine, but just do want to honor any questions that we have at this time.
And we did have one question come up in the chat so far. Lindsay asked, can one organization submit multiple grants?
And yes, and Lindsay, I just see your email on that and would like to talk offline. Technically, it depends on how that would operate. For example, if you are applying as a member of a coalition, if your organization is a member of a coalition that's interested in applying, then that organization may apply as the lead applicant in their chosen issue area and still be considered as a coalition member or supporting organization of another organization in a different area. But if you are, for example, if you are thinking about submitting 2 proposals, one for your own project and one as a fiscal agent for another entity, then the answer for that would be no. But I would love to talk with you offline to kind of see what you're thinking. Okay, if that was our only question, just want to give a moment for any other questions that there may be. Feel free to type them in the chat, or you can also unmute if you have a question. So I'll just give a moment for that.
Yes, and while we give people a second to add any questions they would like to have answered, Deanna asked, how will FAQs be updated?
You will just provide that information. You can reach out to me, and then we will be updating the FAQs as questions coming in. So, and then uploading the revised one on our website. So if we don't, oh, go ahead.
Sorry,
was there another one?
I was just going to tell you, it looks like that is it from the chat.
All right, perfect. Well, we are at 3:01. Again, we want to thank you so much for joining us today. I know we covered a lot of material. If you do have further questions, please don't hesitate to reach out to me. You have my contact information here. So I'm available by phone or email. So again, we just want to say thank you. Thank you so very, very much. And we will be in touch, and good luck. Bye now.